Hello, my name is Stephen Tam, and I'm a geriatrician at UC Irvine's Division of Geriatric Medicine and Gerontology. Thank you for joining me in the next episode of UC Irvine's series on a provider's role in cultivating a culture of caring for older adults. This presentation was made possible by funding from the Health Research and Service Administration. The following 5-minute presentation is an overview of evaluating memory complaints and managing a patient with dementia. Memory complaints are a common concern of older patients in the physician's office. However, it's important to note that not all memory concerns are indicative of dementia, and that memory complaints typically fall in a spectrum of memory changes. Typically, we must exclude out any contributing causes, but there certainly are normal changes in memory that can occur as one gets older. This typically appears as inefficiencies in the recall and storage of information. For example, it's not uncommon when we have difficulty recalling the name of someone that we see on television, but we're able to come up with that information later on. It's important to note that this information is not lost, just that we are delayed in bringing it back up. This is just one of many examples of changes that can be associated with aging. Now, with objective testing, we might actually find deficits, evidence of deficits in memory or other cognitive domains. If there is no decline in daily functional activities with this change in cognitive function and no other explainable causes, then this can be representative of a mild cognitive impairment, which has a higher risk of converting to dementia. Now, on testing, when there are cognitive deficits present and there's a decline in functional activities, and there are no medical, psychiatric, or other explanations, then this can be indicative of a dementia and what is now termed a major cognitive disorder. There are many forms of dementia or major cognitive disorder present, and the most common is Alzheimer's disease and the most feared, with its hallmark feature of short-term memory loss early on before progressing into other cognitive domains. Lewy body disease, frontal temporal disease, and vascular etiologies are other common causes. Now, to evaluate memory complaints, the workup generally involves getting as detailed a history from the patient or informant as possible, including the extent of the memory deficit, as well as the impact on daily function, medications, as well as social and family history. Then, performing a thorough neurological and physical exam to evaluate for any clues that might point to the etiology of the deficits. In addition, we must perform a test to assess the memory function, and this test can be in the shape and form of many different tests that are available out there, including a mini mental status exam, Montreal Cognitive Assessment, or a mini cognitive test, which can be a quick screen with a 3-item recall and a clock drawing task. Next, laboratory workup can be typically done, which includes testing to include out medical reasons for memory impairments, including a comprehensive metabolic panel, blood counts, thyroid function assessment, vitamin testing, as well as additional tests based on the risk factors driven by the history obtained. Imaging can be helpful, and it should be done to exclude cerebral vascular disease, structural changes, and evaluate for patterns of atrophy. Additional imaging studies can be done to evaluate for amyloid and with PET scanning if it's appropriate. This testing and workup helps to evaluate for any reversible causes that can include metabolic, endocrinologic, infectious disturbances, alcohol, drug, medication-related etiologies, sleep disturbances, as well as psychiatric causes including depression and anxiety. Also, consider neurological referral if there are unusual or atypical findings in your assessment, including early onset of symptoms, other reported neurological symptoms, as well as an atypical finding that you might pick up on neurological exam. This workup helps to determine where the spectrum of memory changes your patient's memory complaints may fall on. And if it is a dementia, the type of dementia it may be. Now, if the diagnosis is dementia, here are some considerations in managing your patient. Be sure to encourage activities that promote cognitive, physical, and social stimulation for your patient to help them keep engaged and stimulated. Other non-pharmacological measures to make sure to ensure early on include attending to personal care needs of the patient, identifying recreational and relaxation techniques to help the patient stay calm should they become agitated, encouraging attendance at support groups to help the patient as well as the caregiver help cope with their current changes and impending changes. Also, evaluate the safety of the environment that the patient is currently living in, as well as identifying changes that may occur should the patient have to change settings. Lastly, if the patient has agitation symptoms, try to identify if there are any factors at home or in his or her environment that may be stimulating or causing it. Should your patient be diagnosed or their findings are consistent with Alzheimer's, it may be prudent to do a trial with a cholinesterase inhibitor or memantine. And if your patient has significant mood symptoms or behavioral symptoms and non-pharmacological techniques and redirection are not helping, you may have to consider a trial with medication therapy. Lastly, be sure to address the other issues that are affected by dementia. This includes caregiver stress, looking at what the optimal living situation might be for your patient. Make sure that advanced care planning needs are addressed, as well as talking about driving and home safety. In summary, memory complaints fall in a spectrum of change. Workup generally includes a thorough history and physical exam, cognitive assessment, laboratory workup, and imaging. Finally, again, be sure to address other issues that may be affected by dementia, including caregiver stress, safety, the living environment, as well as advanced care wishes. Thank you for your attention and your time.